Hello, this is Dr. Hussain from DMH Functional Medicine. Today's topic is selenium for thyroid health, and selenium is a very important substance, and we'll go into some details about that. Of course, this is not personalized medical advice. This is just for informational and educational purposes. So speak to your doctor if you need any medical advice. Anyway, before we talk about the thyroid, the role of selenium in thyroid health, I just want to give you an overview. We have the hypothalamus in the brain, which sends a signal, thyroid releasing hormone, to the pituitary, which then releases thyroid stimulating hormone, which then goes and affects on the thyroid and makes the thyroid produce T4 and T3. Now, this production requires thyroid peroxidase. Thyroid peroxidase is an enzyme that catalyzes this process, the production of T4, and this is a selenium-dependent enzyme. Okay. T4 then travels from the thyroid to the peripheral tissues and is converted to T3. T4 is at the inactive form and T3 is the active form. And 80% of the production is T4 here and 20% is T3. Now, T4 travels to the periphery and is converted to T4 is converted to T3 and to reverse T3. This requires another enzyme that is iodothyronine deiodinases, and we have three types of this. We have D1 and we have D2 that converts T4 to T3, and we have D3 that converts T4 to reverse T3. Reverse T3 is the inactive form of T3. It prevents the cellular reactions that T3 would. It sits on the same site, but it doesn't have the effects that T3 would have, but it's able to fit into the same receptor site. Now, these two, they are also selenium dependent. Okay. So anything can go wrong. If you are hypothyroid, it could be you're simply not able to produce more because your thyroid stimulating hormone is not sufficient, and the signal to the thyroid to produce thyroid hormone is diminished, and thereby it doesn't have the same production. But it could be the signal from the pituitary is fine and it's telling the thyroid to produce more hormones, but the thyroid is lacking, for instance, selenium. It may also lack other micronutrients. But if it's lacking selenium and TPO is selenium dependent, well, in that case, it may have the signal, but it's not having all the ingredients required to produce T4, which could then give you a diminished thyroid hormone production. But even in the periphery, it could cause you to have less conversion from the inactive form T4 to T3 if you again are lacking selenium, because these two enzymes are not being activated, or they are lacking the cofactors they need to be able to produce T3. This process, T4 to reverse T3, is not selenium dependent. So this reaction could occur in the absence of selenium. So D1 and D2 is selenium dependent. And then even if you have all of this is fine, you have TSH is fine, the production of T4, T3 is fine, and you then have sufficient conversion from T4 to T3. Even in that case, T3 has to work on the nuclear membrane and the cell. If the receptor site is lacking, say, vitamin A, if it's lacking vitamin D, or if there are other micronutrients that are not present, that are needed for the function of T3, you could still have a situation where the cell is not stimulated properly despite the presence of thyroid hormones. So anything could go wrong here. The TPO, the deiodinases could go, the activity can go down due to the lacking of selenium, or insufficient presence of selenium. So let's go into further details. So the TPO, as we said, this is a selenium dependent enzyme, and it's important for the production of thyroid hormones, and it catalyzes the reaction of iodide with thyrosin, which is sitting on the thyroglobulin molecule, and thereby it produces T4 and T3. Actually, it produces T1 and T2. They go together to form T3, or you have T2 and T2 going together and forming T4. So, but anyhow, you still need, so the production of T1 and T2 requires TPO activity, and that is then dependent on selenium. The deiodinases, its job is to remove iodine molecules from the T4. It's the conversion from T4 to T3 that we just talked about, or conversion to reverse T3. So D1 and D2 actually does the conversion from T4 to T3, and D1 is found in the liver and the kidney, while D2 is found primarily in the brain, pituitary and brown adipose tissue. So we have them over here, as we mentioned earlier also. And then we have the D3, which is found in the brain, placenta, and it's also found in skin and the pregnant uterus. It's the conversion to reverse T3, and it's a selenium independent enzyme. So if we are lacking selenium, we have insufficient intake of selenium, we will have diminished production of T3, but we can still produce reverse T3, which slows down our metabolism. We don't want that to happen. Now, although the glutathione peroxidase is not directly involved in the production of T4 or T3 or the conversion of T4 to T3, we have a constant production of substances in the body all the time in every cell in the body. And with that, there's inflammation, there's oxidative stress, and there's wastage. And all of that wastage needs to be cleared, otherwise it will pile up and cause inflammation. So there are certain parts of the body, there are certain processes that are constantly involved in the cleaning of the whatever waste product we make. And we have the glutathione peroxidase. Glutathione is also considered to be the master antioxidant in the body, and it's very important for many organs. We have multiple subtypes. We have total 5 subtypes that we'll be discussing today. The GPX1, 3 and 4 are present in the thyroid. They reduces hydrogen peroxidase or lipid peroxidase, which both create oxidative stress. And the GPX protects the thyroid gland by reducing that oxidative stress. This is also selenium dependent, and this may be the reason why we see patients that have Hashimoto, so they have thyroid antibodies. If you supplement with selenium, you can see a reduction in the number of anti-TPO, anti-TG antibodies. This may be a GPX effect. This is not totally clear yet. So let's just look at some of the subtypes. GPX1 is the most common. It's found in the thyroid and the liver. The liver has a very important anti-inflammatory function. As we know, detoxification takes place there. A lot of detoxification happens there. And GPX1 is found in nearly all blood cells. GPX2, glutathione peroxidase is found in the lining of the GI tract. The GI tract is constantly exposed to oxidative stress, simply because in our food, in whatever we eat or drink, we take in a lot of toxin, a lot of inflammatory substances. We have bacteria, we have viruses, we have yeast, and constantly there's stresses in the body, the oxidative stress that the GI tract has to deal with. So having a healthy GI tract is super important for us. GPX3 is produced in the thyroid and released into the bloodstream, and it's found in blood plasma. The GPX4 is found in many cell types, including the thyroid and the liver. It neutralizes the lipid peroxidase, lipid hydroperoxidase, but it's lipid peroxidase, which is important because it can actually damage the cell membrane, and all cells have this cell membrane, so we don't want lipid peroxidase to be too high. We want it in control, and GPX4 is responsible for that. And finally, we have the GPX5, which protects the sperm from oxidative stress. So this was a brief presentation of the role of selenium in thyroid health. Keep in mind, selenium is just one micronutrient. It's just like if you produce a car, you could say, well, something may be very essential and something will be maybe good to have. But without selenium, if you are deficient in selenium, it will severely impact on your thyroid health. It would be something like saying that if you don't have a motor in a car, well, then you would be suffering. The car will not be working that well. But it's not enough just to have a motor. You still need zinc, you need vitamin A, you need vitamin D for thyroid health, you need vitamin B2, B3, B6, B12. So this is just one very important part of the puzzle, but it's not the complete answer to anything hypothyroid. Keep in mind, in conventional medicine, we mostly treat, if we see someone is deficient in thyroid hormones, what we do is we replace it with thyroid hormone substitution. But it could be if the reason for you being producing too little thyroid hormone or having too little conversion from T4 to T3, if that is simply the lacking of ingredients to make the conversion or the production, well, in that case, maybe we should be looking at how to fix that dysfunction, how to fix the dysfunction rather than just replacing the thyroid hormone. So if you are hypothyroid, I do recommend that you have your selenium checked rather than directly jumping to thyroid hormone replacement. You need to speak to your doctor, of course. This is not individualized medical advice, but this is certainly worthwhile checking if you have been diagnosed with hypothyroidism. Thank you for watching. Do like the video, share it with your friends and family. Hypothyroidism is very common, and 50% of people with hypothyroidism, they go undiagnosed. So it's a very common disease. Chances are friends and family might be suffering from hypothyroidism. They may be suffering from selenium deficiency. So share the knowledge with them also. Subscribe to our channel and click the notification. Thank you for watching.